The Mockingbird Society's mission is to transform foster care and end youth homelessness. Our vision is that each and every young person, regardless of race and individual experience, reaches adulthood with an equitable opportunity to thrive. There are 3 programs that live under the umbrella of Mockingbird: youth programs, public policy and advocacy, and Mockingbird Family. Using a racial equity lens, these programs work in tandem to center the voices of young people with lived experience of foster care and youth homelessness, create policies that address the systemic problems that young people identify, create new and effective methods of foster care delivery, offering more agency, support, and stability to children, youth, and families, and address the upstream issues surrounding youth homelessness in innovative ways.
Youth Programs supports chapters of young people with lived experience across the state of Washington. We believe these young advocates are the most important voices to elevate when it comes to identifying problems and proposing changes within the child welfare system. These young people identify problems related to foster care and homelessness and work with our public policy and advocacy team to create our annual legislative agenda. We partner with young people throughout our advocacy cycle as they identify problems, develop solutions, refine those proposals, and advocate for change.
In partnership with youth programs, our public policy and advocacy team works closely with each Mockingbird chapter through the advocacy cycle. 2 milestones in the advocacy cycle are our Youth Leadership Summit, where young people present their policy ideas to system leaders, and Youth Advocacy Day, when young people travel to Olympia to meet with legislators to discuss policy proposals. Mockingbird's youth programs and public policy team have contributed to over 69 legislative wins, impacting policy at both the state and federal levels.
Our 3rd program, Mockingbird Family, works with child-placing agencies to transform their foster care structure and practices. Mockingbird Family asks, what if our systems are rooted in the oldest system of care, that of an extended family? Mockingbird Family emulates an extended family by bringing together 6 to 10 foster families around one experienced provider called a hub home. The hub home parents organize monthly gatherings for families to connect and support one another, creating micro-communities called constellations. One of the most important outcomes of Mockingbird Family Constellations is how it can create ongoing support for young people reunited with their biological families. This anchors us in Mockingbird Society's philosophy that, rather than having leaders who are far removed from young people and families determine what systems of care should look like, we support local communities as they create their own solutions and norms for supporting young people.
Youth programs, public policy and advocacy, and Mockingbird Family all aim to bring the right voices to the decision-making tables. The people closest to the child welfare systems are the most knowledgeable and most important voices to elevate as we move towards transforming foster care and ending youth homelessness. We center the voices of young people with lived experience through our youth programs and our public policy work, and we center the voices of community members through Mockingbird Family. We do all of this because we know that these individuals and families know their communities better than anyone else, and we know that there is power in community that can't be replicated in the traditional approaches that our nation and state have leaned on for so long. We know that in community, we can create the changes that would make our systems of care more effective.
Transformative work and healing always takes place in the context of community and relationships, and with the support, leadership, and guidance of our community and the voices of lived experience experts at the center of our work, Mockingbird will press on toward a transformed foster care system and the end of youth homelessness.